Hello, everyone, and welcome out to Fairview Park Hospital. It's Occupational Therapy Month, and we have a couple of people here with Fairview Park Occupational and Physical Therapy. We're here with Terrance and Rebecca. Terrance, tell us a little bit about yourself.
Well, my name is Terrance. I am an occupational therapist from Atlanta, Georgia, and I've been working for a year, and I really love the profession, and I love working here at Fairview Park.
All right, Rebecca, tell us about yourself.
My name is Rebecca. I'm from Valdosta, Georgia, and I first heard about occupational therapy through my siblings who both have Down syndrome, and got to see what occupational therapy does with children, and then in school I got to see what they do with adults. And been here at Fairview for 2 years, almost 2.5, and I really enjoy what I do.
So, Terrance, it's National Occupational Therapy Month. What does that mean to the public?
To the public, it's just a time for awareness to let people know what we really do as a profession. It's a time for us to advocate for ourselves and to let people know that we are here and that we're here to help.
What area of occupational therapy do you work in?
We have 3 different areas here at Fairview Park, and I work in all 3 different areas. We have acute care, which is the first step of the therapy program. Then we have inpatient rehab, where they get a more intensive therapy. And then we have outpatient therapy, where they get to fine-tune their skills and to just freshen up on everything and make sure that everything is where we need them to be.
All right. Rebecca, what area do you work in?
I work in all the areas as well, but in outpatient I work mostly with pediatrics.
Yeah.
So
You have a real passion for that.
I do.
Yeah. And what ages does that include, up to what?
I have some kids who are up to 10. I think that's the oldest that I have right now, and some of them are, some of my smaller kiddos are between 1 and 2.
So you work with them in the hospital and those out of the hospital as well?
I pretty much work
Outpatients?
with them just in outpatient,
Okay.
making sure they're able to hit their developmental milestones so they can continue growing and learning the things that they need to do at the age that they need to learn them.
All right. We're glad it's National Occupational Therapy Month, and we're glad to be able to come out and speak with you all. Now, you all have some of the specific areas lined up, so people who actually work in outpatient, acute, and what's the
Correct.
And the inpatient rehab.
other? Inpatient rehab, yeah. Okay. Thank you all for joining us today. We look forward to meeting some of the other occupational therapists here at Fairview Park Hospital. Okay, now we have Sierra here. Now, Sierra, you work with acute care?
Yes, my name is Sierra, and I'm a certified occupational therapy assistant here at Fairview Park Hospital. And I sometimes work in acute care as well as inpatient rehab. On acute care, we work with people who come in mostly through the emergency room, who may go to intensive care or go down to the medical floors, which is 3rd and 4th floor.
So about how many patients you work with a day?
Anywhere from 8 to 14.
Oh, okay. Pretty busy day for you then.
Yeah, that's a real busy day.
All right, and so how long have you been with Fairview Park?
I've been with Fairview for 3 years.
Okay. Do you live here in Dublin?
I do.
All right. Tell me what kind of training you have to have in order to be an occupational therapist.
I went through Middle Georgia College, where they have a 2-year associate degree in occupational therapy assistant. And
What year did you graduate?
2014 is
All
when
right.
I graduated.
Yeah. So you've been an occupational therapist for what, 3 or 4 years now?
Yes, sir.
Always here at Fairview?
No, I started in a subacute rehab in a nursing home, but I've been here for the longest time.
What's the most rewarding part of your job, Sierra?
Well, let me just speak on acute care. When you go down and you see someone come in with a medical condition from the ICU or CCU where they can't move or anything, we kind of work with them with passive range of motion, which means we do most of the work and moving their limbs until they're able to like sit on the edge of the bed and do some grooming tasks. And just seeing them come from there to the medical floors, and sometimes they make their way up to the 6th floor, which is the inpatient rehab, and then we're able to get them stronger and get them discharged back to home to their baseline, which is where they were before they ever got sick.
Sounds wonderful, Sierra. Thank you for what you do in occupational therapy.
Thank you.
And now, everyone, we're talking to Lacey. And Lacey, you work with inpatient care, right, for occupational therapy?
I do.
All right. Tell us a little bit about that, Lacey.
With inpatient, they come in from within our facility, or sometimes they come from other facilities. Inpatient gives a more intense rehab experience. You get an hour and a half of each discipline on inpatient rehab.
What do you mean, an hour and a half of each discipline?
You're getting an hour and a half of physical therapy, occupational therapy, and then sometimes speech as well.
Okay. All right. Tell us about your typical day.
Usually 4 patients is our caseload. Normally we see each patient in the morning. We do bathing, dressing, we do grooming tasks, just getting them back to where they can bathe and dress and do the things that they used to do, to go home to be more independent. And then generally in the afternoons we work more on doing upper body strengthening, balance activities, endurance, to just get them back to where they can progress back into the community and do their home management task as well.
What's the average stay of a person like that in order to be able to rehab?
Usually anywhere from 2 to 3 weeks is a normal rehab stay.
Yeah, so you get to know your patients pretty
Oh
well.
yeah, we do. We get to see them come in and progress, and it's very rewarding to see that process.
Yeah. So an inpatient lasting 2 or 3 weeks, you get to know them well, and then they get to go home. And I'm sure there's still things they have to work on once they go home, right?
Oh yes, and a lot of times, more than likely, they'll either have home health come out to their house afterwards, or a lot of patients get outpatient services too.
Yeah. How long have you been with Fairview Park?
I have been here about 8 years, off and on.
Tell us about some of the rewarding things you've seen in your job.
Just really seeing people that have come in at a very low level and get their independence back, being able to help them to where they can just get back to enjoying their normal life routines, taking care of themselves, and just enjoying their life.
All right. Lacey, thanks for sharing with us. And congratulations on being an occupational therapist. We salute you during this week.
All right, thank you.
All right, now, ladies and gentlemen, this is Beth. And Beth, you work with outpatient therapy,
I
don't
do.
you?
I do.
Tell us about that. Now, what does that mean?
Outpatient therapy are patients that come in from their home, and we treat them here.
Okay. And so give us an example of someone who is an outpatient and what type of service you'll be providing.
It could be a surgical patient. We have patients that have rotator cuff repairs, elbows, wrists, knee patients, strokes, CVAs, all
Many.
kinds.
Yeah, many. Okay, and how long have you been with Fairview Park?
I have been here 16 years.
Oh, that's wonderful. A lot of service, and you've helped a
Yes.
lot of people over time,
A lot.
haven't you, Beth?
Yes.
You see them out in the community. I'm sure they
Yes.
appreciate you, don't they? All right, so let's talk about a couple of success stories, if you think of one or so.
Oh, there are many.
Good.
Recently had one, and he was really special. He was an amputee, and he brought us bubble gum. And when he came in, he was in a wheelchair, and when he left, he could walk.
That is rewarding.
Gave us bubble gum. It written on it was said, "I rolled in, but I walked out."
How nice is that? I can tell you really care. It's stories like that, ladies and gentlemen, that show what Fairview Park Hospital, specifically
Yes.
occupational physical therapists, are able to help us with here. And we thank you so much
Thank
for your
you.
service during occupational
Thank
therapy.
you.
Okay, now we're with Olivia. And Olivia, you are responsible for a student program, and you have one of your students here. Tell
Yes.
everyone who you have with us.
I have Clarice Gordy with us for now. She's on her level 2 field work from Middle Georgia State University.
All right, welcome to you.
Thank you.
And so how many years have you been in school?
This is my second year. I will graduate this May, actually.
Congratulations
Thank
early
you.
then.
Yes, yes.
So how do you find the program?
How did I come across
How
the
do you
program?
find it? Yeah, your experiences with it.
Oh, I had a wonderful time. We had a great time, not only with the instructors, professors, and of course the campus itself, but just being able to understand the fundamentals and the basics to be able to be at this point from observation with level 1 to now hands-on experience with patients, family, of course, the healthcare professionals and so forth.
So Olivia, you have Clarice here with you, and you wanted to bring her in just to show us an example of those students that you have coming through Fairview?
Correct, just to kind of and show that we enjoy teaching others the skill of occupational therapy and give them the interactive skills and what they need to go out into the working force when they graduate.
Okay, so what do we tell a person out there who may be interested in occupational therapy? What's the first step?
First step is find local schools. There's several OTA programs in this area. There's one in Augusta, one in Cochran, Albany. That's the only 3 I can think of OTA. And then occupational therapy programs, there's one in Augusta. That's the only one I can think of right now, but there's several.
Okay. Clarice, what type of program is it, a 2 or 4 year degree?
It's a 2-year degree, an associate's year program. with that being said, in addition to what Olivia stated, my supervisor, not only that you can find a program as far as educational, but you got to have compassion. You're working with people nonstop, and that exactly is what we aim for, is to be able to empathize with one another, because you never know their walks of life.
So how do you help students develop through Fairview Park?
We give them a kind of a guideline what they're expected to do from week to week, and they're here. OTAs are here from 8 weeks, and then OTs are 12 weeks, and just kind of break it down with them. Go in there and they watch us work, and then we slowly transition them into taking over the caseload.
So is there a specific area that you help them develop in? Do they naturally evolve into one area?
It just depends on what therapist is available it takes them. I'm in inpatient rehab, so Clarice is with me in the inpatient setting, but we also take students in outpatient setting and the acute setting. So
All right.
all
Thanks
kind
for
of
sharing us.
levels.
Thanks for sharing with us a better view of occupational therapy in the student program. Okay, now we're with Stacey Davis, the Director of Occupational Therapy here in the Rehab Center, really. We've spoken to you before, and thanks for coming back in and for lining all this up today so that the public can better understand what occupational therapy is all about and Occupational Therapy Month. So we realize the opportunities to be able to get help in developing in life and having a better quality of life, which we all want, but we're all going to face things in life, whether young or old, handicapped or not, where we have issues, and therapy can help us in many ways, can it?
It sure can.
Yeah.
Like you said, I'm Stacey Davis, and I'm the Director of Rehab and Therapy here, and I've been here for 16 years and absolutely love what I do here for Fairview. And as HCA as a corporation, we've just been voted for 10 consecutive years the most ethical corporation. That's something that we can be very, very proud of. We focus on our ethical behaviors here and the way that we treat patients. And that's something that we are very, very proud of. Another award that we've just received for last year, for 2018, was our Top Performer Award, and that's for our inpatient rehab. And what that award is it recognizes us out of over 800 facilities in the nation, that we're in the top percentile for our outcomes. And what's involved in our outcomes is a patient coming into us in inpatient rehab, and we start with teaching them how to bathe themselves, feed themselves, dress themselves, get off and on the toilet, in and out of the bed.
Yeah.
And it's the changes that they make from when they come into us to the time they leave us. And that's what that award is based on. So we have just received that as well for 2018, and it's something that we're very, very proud of.
Congratulations.
Thank you. And the other thing here is we get to spend the one-on-one time with our patients in all of our areas, and that is huge because we do get to develop that relationship with our patients. We get to know them, they get to know us. We have the consistency in our staffing that we develop that one-on-one and just continue to help them focus on getting independent. And that's what occupational therapy is all about. I've been an occupational therapist for 30 years and have loved my field. And we work in a lot of different areas, but for this hospital, we have the acute care, the rehab, and the outpatient. And we get to see the whole continuum of care. We even get to see them even go into the gym after they finish us. So we just have the whole continuum of care here at Fairview.
Yeah, and so once again, congratulations. And again, you've been able to show us through the people we've had on the compassion that it takes to be a therapist, to be able to help the public, and the emotion that goes into it, and the rewarding part of it. Thanks again, and thanks for having us out today. If you know an occupational physical therapist, you want to be sure and recognize them during Occupational Therapy Month. And once again, from Fairview Park Hospital, thanks for joining us.